everyone see this? So the lacrimal, think about your lacrimal ducts, your lacrimal glands, right, are right in the corners of your eye, right? And the eyelid is more pronounced. Why are you laughing? Okay. And the eyelid is more pronounced, right, on the top side. So if you look at the cow eyeball from this side, right, you've got your eyelid here, and your lacrimal gland is on like the front corner of the eye. Okay. So if we look at it from this view, and keep in mind it will tell you, like on the exam we'll have like a piece of paper that says like dorsal, ventral, anterior, posterior, like your 4 directions, so that when you look at this it'll be like how you see it in the book. Does that make sense? And you won't have to like be confused about which way you're looking. Okay, so obviously we have the large optic nerve here coming out of the back of the eye. This muscle surrounding the back part of the eye is the retractor bulbi muscle. Okay, so that one's, you know, those 2 things are super easy. Okay, the other things that we have, so then we have the lacrimal gland here. You can see how that's spongy glandular tissue, and different than the fat that we cut off, and different than the muscular tissue here. The lacrimal gland is, you know, very distinct. Some of you may or may not have the lacrimal gland in yours. So we have 2 vertical muscles here. Those are the dorsal and ventral rectus muscles. Okay, then we have 2 muscles going laterally. Okay, so we have our lateral and our medial rectus. Okay, so dorsal and ventral, lateral and medial rectus, and then we have our obliques, right? Just like the obliques in the abdominal area, obliques go at a diagonal. Okay, so we have our and then we have the one over by the lacrimal gland, the levator palpebrae superioris here. So here we have the dorsal oblique. Oh, I think I messed up when I said dorsal and ventral rectus. This one is the this one's the ventral oblique, and this is the dorsal oblique, and the rectus muscles are smaller, right? So like this is your dorsal rectus and this is your ventral rectus. Okay, this is your ventral oblique and dorsal obliques. Yeah, they're more at a diagonal than straight up and down. Okay, so dorsal and ventral rectus, dorsal and ventral oblique, lateral and medial rectus, and then your skinny little levator palpebrae superioris over here in the corner, the lacrimal gland on the front, retractor bulbi muscle surrounding the eye, and the optic nerve there. Okay, all nice and clear? All right, if we flip it over, I'm glad you guys find that so amusing. So the sclera is the white part of the eye, right? Then the pupil is it's kind of hard to see in a preserved specimen. I know like it's not nice and clear like this, also because they have a cat eye, which is typically like lighter colored iris. But the color, so like the sclera is here, right? Just like in us, the white of the eye is the sclera. The colored part is the iris, just like in us, and the dark part, which is, it's really hard to tell that it's like dark because of the preservation, but the dark part in the middle is the pupil, which is the opening. And then the cornea then is the covering over the pupil, right? So then whenever you cut into the eye, we'll jump over to look at their specimen.